We knew we were going to fight an uphill battle with trying to convince our community that this is going to be safe.
Millions of dollars are being invested to expand the role of urban Indigenous clinics in Manitoba with the hopes of increasing vaccination rates against COVID-19 among First Nation, Métis, and Inuit people. The province is handing over $2.8 million to support immunization outreach by Indigenous clinics in neighborhoods with lower percentages of vaccine uptake.
Outreach and partnership is more critical than ever as we aim to make the vaccine as accessible as possible.
Audrey Gordon, Minister of Health and Seniors Care, says 5 Indigenous clinics and mobile outreach groups will split the $2.8 million in funding. Here's how it will be shared. $2.1 million will go to the Aboriginal Health and Wellness Center and the Mama Way Wichita Center locations in Winnipeg. Over $345,000 will go to Portage La Prairie Renewal Corporation and Mama Weetalk Friendship Center in Thompson, along with the Friendship Center in Brandon. Over $30,000 will support immunization clinics led by the Manitoba Inuit Association. $65,000 will support a new staff position at Ongo Miswin Health Services, as well as $250,000 for these organizations to operate a mobile immunization clinic over the next several months.
This extension will allow us to provide QR codes and vaccine cards to our community and, importantly, the unsheltered through our mobile efforts.
Della Herrera, Executive Director at the Aboriginal Health and Wellness Center of Winnipeg, says with help from the Main Street Project, her organization has visited over 60 homelessness encampments and they have administered over 22,000 vaccine shots, connecting community members with resources and supports they need, she says.
As of yesterday, vaccine coverage for First Nations people living on reserve is over 90%.
Dr. Marcia Anderson says the vaccination rates off reserve have lagged. However, she applauds the First Nations-led pandemic response team for working with government and community members to get vaccine rates so high on reserve. And she is optimistic that same cooperation will increase vaccination rates off reserve.
It's critical that we continue this model of Indigenous leadership, of Indigenous health experts at the table, at every decision-making table, so we can see the improved outcomes that we are seeing in COVID-19 among First Nations in every health outcome.
In Winnipeg, Mark Neufeld, City News.